Good afternoon. I'm Tom Stolz, Sedgwick County Manager, and we are here today to discuss the COVID update for September 2nd, 2020. We will do this the usual way. We'll go through the numbers, and then we'll talk about some health department updates. The United States now has over 6 million confirmed positive cases of COVID. There was, between Monday and today, there was a 1.42% increase. So we have 6,092,175 cases in the country. In the state of Kansas, since Monday, we went up 3.11%. So we are at 43,940 cases in the state of Kansas. The Kansas deaths are at 458. And Sedgwick County, since Monday, has gone up 1.12%. So we went from 6,893 cases on Monday to 6,970 cases today. The periphery counties, Harvey County has 298 positive cases recorded. Butler County has 484 recorded. Cowley with 266. Sumner with 128. Kingman with 44. And Reno with 804 positive cases historically. From our meeting last week on Wednesday in Sedgwick County, we had 6,597 cases a week ago, and today we have 6,970. That's a 5.65% increase. And if you've been watching these briefings, that's the smallest number we've had in several weeks. So all numbers appear to be moving in the right direction. Our death count has stayed the same for the last week. We are still at 50 deaths COVID-related in Sedgwick County. In county health update news, the health department has tested over, the community has tested over 80,000 residents for COVID in Sedgwick County since the onset. 65 residents were scheduled today at our test site, our drive-through test site, and if you've also been watching the numbers, you know that 65 is probably the least amount during a day we've tested in quite some time, so that number is also going down. The county still is offering no-cost testing for symptomatic residents and people working in certain high-risk professions, such as nursing home worker, and we have since put teachers and paras, school staff who are front-facing towards students who are in session can also go receive a test asymptomatically at our drive-through location. We are caught up. Next day appointments are being made through 211. And with the new results portal being implemented, patients are now able to access test results as early as 3 days after sampling. And that's going through the state lab or our outside lab. The mobile outreach team will provide COVID-19 testing for symptomatic residents and those people that I described above, the high profile or high risk professions, teaching, nursing home professionals, etc. From 8:30 to 11:30 a.m. next week on Tuesday, September 8 at Bethany United Methodist Church, which is at 1601 South Main in Wichita. And then we will be in Park City on Wednesday, and they're still determining a location for that. So it'll be from 8:30 to 11:30 in Park City, and we'll get an exact location out to the media and via the press as soon as that is determined. Just in the line of testing, Tim Kaufman yesterday at our staff meeting talked about saliva-based testing will become implemented next week. We have contract with a out-of-town lab that will provide us materials, and so we will be transitioning our drive-through location and our mobile outreach team slowly over time from nasopharyngeal swab technique to saliva-based testing. We will ramp that in slowly, but the goal is, and we've been pretty clear with the goal, that as a community, we'd like to be able to do 2,400 tests per day. And so we will be, over the next few weeks, ramping up to that number using saliva-based solution for testing. In addition to the external lab, we are working currently with Wichita State University to get their lab up and running. And as they are sanctioned as a lab, we will migrate all of our testing over to Wichita State University sometime late in September, early in October, hopefully. At today's commission meeting, the commissioners approved almost $150,000 to purchase a whole body scanner for the sheriff's office. As we all know, that the sheriff's department has challenges at the jail in dealing with COVID. Had a number of inmates who are positive, and they've had some staff unfortunately come back positive as well. This body scanner that we are purchasing for the sheriff's department out of CARES dollars will enable them to maintain better social distancing and limit the physical contact between the staff and the persons entering the facility. So that item has been ordered. Tomorrow, we're going to host a virtual town hall meeting with 3 local physicians beginning at 8:30, September 3rd, Thursday, tomorrow. You will be able to watch it live on Sedgwick County's Facebook page and the YouTube channel. And we have 3 heavy hitter doctors to talk about COVID tomorrow. Dr. Mins, who is the health officer for Sedgwick County, Dr. Antonios, who's a medical officer for Via Christi, and Dr. Ebersol, who is a medical officer for Wesley. So our 2 main doctors at our hospitals, and Dr. Mins will be answering questions, COVID-related questions. And we've got a list of questions for them that we have been accumulating over meetings and time over the last 2 or 3 weeks, and the public will also be able to interact and enter some questions, and the doctors will answer as many as they can in a 1-hour time slot. And we'll see how it goes tomorrow. We're hoping that we could do this sporadically to get the physicians heard in this situation involving COVID. There's a lot of CARES information that went out today. Local small businesses and nonprofits are encouraged to apply for funding from Sedgwick County using CARES dollars if these entities have been disrupted by COVID-19. Learn more about the different funding opportunities and submit an application at our website, which is www.sedgwickcounty.org. Deadlines coming up for businesses are September 11th, and for nonprofit entries, September 20th. And we're trying to get our website more friendly so that when people get on under the CARES item, that it is very descriptive and easy to use. The current emergency public health order is in effect at least until midnight Tuesday, September 8th. Dr. Mins will be issuing a revised order sometime later this week, and commissioners will be visiting about that as that order is developed. That's all I have for today. Thank you for your time, and we'll see you next week.